Rotator cuff recovering can be long, painful, and sometimes they don't go as expected. But what many people don't realize is that there are several key factors that can impact just how well you recover, even before surgery. And the good news is that understanding these factors can help you adjust your rehab plan and set realistic expectations. So whether you're just about to have surgery or already recovering, join me in this video as we dive deep into these critical factors that can make all the difference in the success of your surgery. Let's first talk about tissue quality, because it's one of the most important factors influencing just how well your shoulder will recover after surgery. The condition of the tendon, muscle, and bone before surgery determines the success of the repair. In younger individuals, typically those under 50, the tendons are generally stronger and healthier due to the higher collagen turnover rate. This means the tendon is more likely to heal quickly and effectively after surgery. However, as we age, or if the tendon has been damaged by previous injuries or degenerative changes, the quality of the tissue deteriorates. The breakdown of collagen fibers, as well as loss of elasticity, all contribute to a weaker tendon. This means that the healing is going to be slower and the risk of complications, such as re-tearing, increases. The blood supply to the area may also be compromised, further delaying healing. It's really important to be mindful of the pathophysiologic changes at play. Collagen degeneration, decreased elasticity, and compromised blood flow, so that rehab can proceed at a pace that allows for healing without overstressing the tissue in the early phase of recovery. But it's not just the tendons we need to consider. Muscle and bone quality also plays a big role. A condition known as fatty infiltration can also hinder recovery. Fatty infiltration, which often occurs in older patients or those with long-standing rotator cuff tears, reduces the muscle's ability to generate force and recover fully after surgery. In younger individuals, the muscles around the rotator cuff are typically stronger and have fewer signs of atrophy or fatty infiltration, meaning they are more capable of supporting the repair and contributing to recovery. Similarly, bone quality matters. Research shows that patients with osteopenia or osteoporosis face increased risk during rotator cuff repairs, as the bone may not provide a strong enough anchor for the tendon to heal securely. Poor bone quality is associated with higher risk of post-surgical complications and re-tearing. So if your surgeon has mentioned that tissue quality is a factor, it's important to understand that it can greatly influence how aggressive you can be in the earlier phases of rehab. If your tissue is in great shape, you'll likely be able to push your rehab a bit harder, regaining strength and movement more quickly. However, if your tissue quality is compromised, your rehab will need to go a little bit more slowly to respect the healing process. But tissue quality isn't the only factor at play here. How long the rotator cuff tear has been present also greatly impacts recovery. Acute tears, which happen suddenly, like after a fall or an accident, tend to have a much better prognosis. This is because the muscle tissue surrounding the tear is still relatively healthy. The tissue is still in good condition, making it easy for the surgeon to repair it. In contrast, chronic tears, which are injuries that have been going on for months or even years, present a much bigger challenge. Over time, these tears can cause irreversible changes to muscle tissue. You may see the development of scar tissue, fatty infiltration, and muscle atrophy. These changes make it much harder for the surgery to restore the tendon's full function. The longer the injury persists, the more muscle fibers become damaged, weaker, and less elastic, making it difficult to secure a strong repair. This damage also means the tendon may have retracted further from its original attachment, making it more difficult to reattach during the surgery. The rehab process takes much longer, and you must be extra cautious to avoid overstressing weakened tissue. Ultimately, the longer the injury has been there, the more difficult it will be to regain full function and strength after surgery. But there is one other factor that can heavily influence surgical success. The size of your rotator cuff tear can have a direct impact on your recovery, and this is a crucial factor that your surgeon will consider before recommending treatment plans. Small and medium tears generally have a better functional outcome, meaning people can regain nearly full strength and range of motion within the first year after surgery. Research shows that smaller tears tend to heal faster and result in better recoveries, with less risk of re-injury. But how do you know the size of your rotator cuff tear? Well, one way is through an MRI, but your surgeon will have a clearer understanding once they can actually see the injury firsthand during surgery. Small tears, typically less than 1 centimeter in width and involving only one of the tendons of the rotator cuff, tend to have the best prognosis. These tears are less complicated to repair, and since there's minimal damage to surrounding tissues, the recovery process is much quicker. People with small tears can generally regain full strength and range of motion within the first year, allowing for a more aggressive rehab approach that can focus on rebuilding strength and mobility at a faster pace. Medium-sized tears, which range from 1 to 3 centimeters, are a bit trickier. Although they still have good healing potential, they require more attention both during surgery and rehab. The surrounding muscle and tendon tissue may be more damaged, making the surgical repair a bit more complicated. Recovery can take a little bit longer, and there's a slightly higher risk of complications, including incomplete healing and re-injury. Rehab for these tears are generally more cautious, with focus on gradual restoring strength and function without pushing the healing tissue too hard. Then you have large and even massive tears, which are over 3 centimeters, which are the most difficult to treat. These tears involve multiple tendons and require a more complex surgical repair. The recovery process for large tears is much slower, and regaining full range of motion after surgery can be very challenging. In addition to the size of the tear, the extent of retraction, which is how much the tendon is pulled away from its attachment site, can significantly influence how quickly you can progress through your rehab. The more retracted the tendon, the slower the rehabilitation process will be. Studies have shown that tendon retraction to be one of the strongest predictors of post-operative failure due to re-tearing, which is why the rehab approach for large or retracted tears needs to be particularly cautious. Because of the poor healing and low success rates in those with larger tears, a reverse total shoulder replacement is often recommended in these patients. Understanding these factors that influence the success of your rotator cuff surgery helps set you up for a more informed and effective recovery. While some of these factors, like age or tissue quality, may be beyond your control, being aware of them can help you work with your surgeon and physical therapist to develop a plan that suits your unique needs. Your path to recovery might take time and require some adjustments along the way, but with patience, a solid rehab strategy, and the right mindset, you can maximize your chances of regaining strength, mobility, and overall function of your shoulder. Keep these factors in mind and you'll be better prepared for the road ahead. If you found value in this video, don't forget to hit the like button to support the channel. And make sure to subscribe so you can stay updated on everything you need to know about your body, how it works, and what it needs to keep moving.